Good afternoon, class. So we want to continue with colostomy care. So at first we did colostomy care, which wasn't discharging, which was a sterile procedure. There was no effluent or fecal matter. So this one has got fecal matter. So since it's got fecal matter, we're going to regard it as a clean procedure. So it has effluent or fecal matter. So it becomes a clean procedure. So clean procedures are very easy to do as well. So let's just see how we're going to do it. And washing first. Okay, so you have to dry your hands as usual. Good morning, Mr. Mlenga. I'm student number 2. I've come to do colostomy care on you. May I please go ahead? Okay, is there anything I can do for you before I begin? Okay, said nothing. So what about you sleeping? How is it? You want to see, for example, if maybe there's fecal matter already on the bed, so you need to check. Just peep, then close up. Okay, so let me just prepare. I'll be right back. So you just need to straight away wear gloves because it's a clean procedure. Nothing like going to scrub. So this one is straightforward. Okay, so these are just examination gloves that you have to wear. Then if you're, in case you didn't prepare the solution, so the solution we're using is the same solution, which is boiled water. So you have to put boiled water, which is here, as usual. So you're going to use boiled water. You're just going to put there. So at this moment, you can then prepare the swabs. Okay, so you prepare the same number of swabs, 5 to 6 or 7. It's okay, so that you ensure that the site is clean. So at this moment, the swabs are about 5. So this is the 6 if it's okay. So you can, since you haven't touched anything, you can just simply expose the patient. And then this time I'm going to loosen and remove. So you loosen and remove it, but before you remove it, since we are saying there is effluent, you need to put the incontinent sheet. Put the incontinent sheet so that in case effluent was to come out of fecal matter, just to drop on the incontinent sheet. So you can just loosen and then remove it. So how you remove it, I'm going to put it like this so that fecal matter doesn't come out. Then this one will go in a bowl down there. Okay, so since this is discharging, you start from the outside. For sterile procedure, which was a colostomy care, which is sterile, where there was no effluent, you started from the middle part. So this one, which is discharging fecal matter, you start from outside. That's the only difference. So you start from outside. The skin there, so you start from the skin, you discharge. Again, you discard. Then, since it's a clean procedure and there was effluent, so you go now where there is fecal matter now there. So you start removing. There's fecal matter there. That's when you remove it. Again, you do that. Another point, you go in the middle there, meaning you're done. So that's the difference with a sterile procedure and clean procedure for colostomy care. Where there's effluent, you're starting from outside, then go in the middle. So that's what we've done exactly. So at this moment, since there is something there, there's water, you can even dry the skin. Okay, and then the same procedure what we did. My assistant kindly give me Vaseline gauze. So you make this gauze like that. Okay, get it there. Then get Vaseline gauze. Okay, so Vaseline gauze is for prevention of skin excoriation. So you do that. Okay, so you put Vaseline gauze there around the colostomy. Then you put a dry one on top. Okay, so once you do that, then you can ask your assistant also to give you the bag. Okay, to open up the bag for you. So open up the bag for me. Okay, the bag has been opened. So this is a colostomy bag. Then you place it there. Okay, you stick it there. So it has to be stuck there, so it gets stuck because it's sticky. So when it's stuck like that, meaning you're done. So you can even go ahead and give IEC. So thank you very much, Mr. Mlenga, for allowing me to do the procedure. Doing this procedure so that you're comfortable and so that fecal matter does not damage your skin. So whenever it's 3/4 full or half full, try to remind us the nurses to change it. Thank you very much for allowing me. Is there anything I can do before I go? Okay, I said nothing. So you can even cover the patient and go to the ward in charge to say that you have removed or changed the colostomy bag and you have left Mr. Mling comfortable. So at this moment, you can even remove the gloves and do the last part, which is hand washing. Okay, so you can even dry your hands as the last part. So thank you for watching. Keep practicing for you to learn more.